Swedish massage techniques are the foundation and basics of massage therapy. They include stroking, effleurage, and petrissage. Stroking can either be light or deep. Light uses the least amount of pressure out of all the techniques. Therefore, it is generally used as an introductory to contact or while ending a massage. Using the palmar surface of the hand or fingertips, apply short or long strokes at a consistent speed with hands alternating, or use both hands at the same time towards venous return or away. This is good for painful conditions, and it also decreases the sympathetic nervous system. Deep strokes are applied the same way but compress into the tissue. They are generally used to transition from one technique to another or to move onto another area of the body. Effleurage is commonly the introduction to massage therapy treatment. It is a light to moderate pressure with even full contact using the hand, ulnar border, or fingers depending on the area of the body. Long gliding strokes applying the compression on the upward stroke and superficial contact on the return. Effleurage is used to apply oil or lotion, flush or clear tissue, assess tissue, improve venous or lymph flow, decrease pain, and warm the tissue for deeper techniques. Petrissage includes muscle squeezing, stripping, wringing, picking up, and skin rolling. These techniques are deeper in pressure, therefore, can be more specific in treating a group of muscles or individual muscle. They are either compressive, lifting to the tissue, or a combination. For muscle squeezing, compress a muscle group or individual muscle between both hands, or squeeze with one hand. Add a slight lift away from the underlying tissue or structures. For muscle stripping, depending on the size of the muscle being treated, choose either the ulnar border, palm, knuckles, or reinforced fingertips. Use moderate to deep pressure. Follow the length of the muscle in the fiber direction. Wringing is performed with firm but malleable hands placed opposite each other on the area of the body being treated. Compression is applied to the tissue. The opposing force of both hands allows for a lifting of the tissue until you reach a resistance in height. Then the tissue is released and the hands glide past each other on the way to the other side. This is rhythmical as hands go from one side to the other and work proximal to distal. For picking up, grasp the muscle or muscle group with your palms or fingers. Apply enough compression to effectively lift the tissue from underlying tissues of the bone. For skin rolling, little to no oil is used. Skin overlying the muscles is lifted and rolled between the thumbs and fingers. Avoid pinching the skin. Kneading is a steady increase and release of pressure done in a circular motion using the palm, fist, fingers, or thumbs. You can reinforce with the other hand while applying deeper pressure. All techniques increase local blood flow and decrease hypertonicity and adhesions. Depending on the rate of the flow, the techniques can affect the parasympathetic nervous system or the sympathetic nervous system. Compression decreases spasms and trigger points and stretch muscle fibers. Lifting tissues decreases fascial and subcutaneous restrictions.